Known as a health engineer, Garrett has taken his engineering and neuroscience training and created a device that has revolutionized the rehabilitation and fitness world. Combining next-generation electrical stimulation and protocols from functional neurology, Neubie by NeuFit is helping people across the country accelerate their recovery from pain, injury, trauma, and helping them reach higher levels of fitness and performance goals. We would like to welcome the founder and CEO of NeuFit, Garrett Salpeter. Welcome.
Thank you so much, Shannon and Ryan. It's a pleasure to be here.
It is truly an honor. I'm excited to get just right into the questions, and I just want to go straight to the point. What is Neubie by NeuFit?
So Neubie is our device that we use within practice, and what we're really doing is working with people who have all sorts of pain, injury, looking to recover faster from that, recover faster from surgery, or recover more completely and effectively from various chronic issues, sometimes neurological challenges where they may have lost function or strength or feeling, whatever. And so we're trying to help people recover from all those things. And we've seen that by using the Neubie and the NeuFit methodology, we've been able to help people across all these domains achieve results faster, achieve better outcomes, even in the fitness and wellness and performance area, because the common thread throughout all of that, whether you're recovering from pain and injury, trying to restore function that you lost due to a neurological challenge, or trying to optimize workouts to make them safer, more effective, more efficient, the common thread through all of that is the nervous system, which of course controls muscles, controls healing, and controls so much about our health and well-being and our thoughts and our digestion. I mean, everything. So we're really working on that common thread of the nervous system.
Okay, and that's an excellent explanation of it. And I know this is a podcast and we don't have a visual here, but give our listeners an idea of what we're talking about. I mean, this is technology, this is a methodology. Describe what it looks like, how you utilize it.
Yeah, for sure. So let's say you, Shannon, came in with a shoulder injury. So one of the first things we would do is take an electrode pad, like a conductive carbon fiber circle with a wet sponge, and literally scan it around on your body. So be dragging it across your skin. And what that would allow us to do is to identify exactly which muscles aren't working properly, are allowing that shoulder to become compromised in the first place, or delaying the healing process, or keeping you locked in a state where you have elevated threat or instability that can keep you locked in that cycle of chronic pain. And so once we find those areas, then in this example, we would place electrodes on those spots that we found and have you go through different movements and exercises to try to repattern or re-educate the underlying neurological signals that control those muscles. Try to repattern those to help accelerate your healing, to help you, regain your range of motion. Maybe you gain 30 or 40 degrees of range of motion in a session as we help you break through those different patterns, which I'm sure we'll talk about examples like that. But you'll see, if you walk into our facility or the hundreds of places that are using the Neubie, you'd see people with wires and electrodes on them, and they'd be connected to a machine.
Yeah, this sounds fun. I like it. You had me at micros and electrodes on them. This is
And this is really the big difference between the NeuFit method and some of the other therapeutic modalities that patients are looking into. And my background's in spinal mobility. Shanna and I have both used the Neubie and experienced it. And what I think is so interesting is I have patients all the time say, "Oh, my pain's here," and we eventually discover that the problem and the root cause is somewhere totally different that they didn't even think to look at. And I think this is why so many patients tend to miss the root cause in things like traditional PT, where the Neubie can be really helpful in just identifying where we should start kind of untangling these compensation patterns.
I'm so glad you went in that direction. That's
what she said.
Yeah. So can you tell us more about how is the Neubie and the NeuFit method really different from some of the things people may have already tried?
That's a great question, and I'm so glad you took it in that direction about getting to the root cause. And I think that's it's absolutely what we're trying to do. With neuromuscular pain and dysfunction and the types of issues that people come to us or seek out NeuFit practitioners for. And I think it's very congruent with your message. If you're talking about other chronic diseases, you're trying to get to the root cause, not just mask or manage the symptoms. And we're absolutely trying to do the same thing. And in traditional physical therapy, when we're talking about these types of issues, so often people are enamored with, this is tight, this is weak, I need to stretch this, I need to strengthen that. And oftentimes, they don't dig a layer deeper and ask, why is that? The brain doesn't just wake up one day and say, oh, I want to keep that muscle contracted all day. I'd like to burn a few extra calories by keeping that locked up all day. No, in fact, it's the opposite. Our brains want to conserve energy because there might be a famine tomorrow, right? We have these very significant, meaningful, innate survival mechanisms, and that's one of them. Our brains try to conserve energy. So if we're spending energy to keep muscles turned on, it's because there's survival and protective benefit that's worth more than saving those few calories of energy. So oftentimes it's okay, that muscle's tight because it's protecting around this disc or this joint. Or
You're saying there's a purpose behind it. Like our body knows what it's doing. So if it's tight for that reason, it may be actually for
protection,
a justifiable reason, protection.
Yeah.
And so.
And one example of that, a common finding, we have people who will come in with neck issues, like their trap is tight or they have cervical spine, disc or nerve root or different issues in the neck. And we'll go through that mapping process that I described, and we'll find issues in their shoulder. And sometimes it's a fairly straightforward connection there where the shoulder, because the shoulder is unstable, something about that ball and socket joint isn't being stabilized or supported correctly, and the body will try to protect that by kicking in the trap to try to hold the shoulder up and support it from above. And that, of course, then pulls on the neck, creates these torque, patterns of torque into the neck that can be harmful. And we find that sometimes without ever touching somebody's neck, just by working on the shoulder and getting rid of the reason why that neck was tight in the first place, oftentimes we'll find that the neck just immediately softens and the tension goes away and the pain reduces. And, we have these profound outcomes, healing experiences.
I think we've both experienced some of those. I mean, this was an incredible device. When I first found this, I really was interested in it for a patient, but I had 5 broken ribs a year or two before that. I'd sort of like re-injure a little bit every time I'd move incorrectly or I'd do something silly, just living life. And this was the first time I walked out of a single appointment and said, oh my gosh, I have this noticeable improvement. I'm able to move anatomically correct for the first time. And then I see these incredible changes in patients who I think walk in a little bit skeptical after having tried a lot of different things.
Yeah, we can attest to that. We've tried a lot of different things, and you're the reason why how I first heard of Neubie for my own personal injury story. It was actually a year ago, or I guess last April. I ended up having 2 inflamed or bulged discs, and just didn't really know what was going on. But fortunately, Ryan connected me with a Neubie user, practitioner in the San Antonio area, and immediately went to work around the neck area, and it was incredible to actually feel, because I'm a very literal person. I have a lot of belief in different systems, but it's really nice to actually be able to feel what's working and to realize like, oh yeah, that's the spot right there. And after going through that whole process and just the release and the relief walking out of there from the very first treatment was incredible for me. And now other family members have gone through that process for different reasons.
It's hard not to talk about it because I'll meet people just, in my day-to-day life, and they'll say, oh, I've got this just chronic ache, chronic pain. My dad had a shoulder that was just constantly falling out of socket, and we got him over there. And I mean, he so improved so quickly and so much more efficiently than he would have with traditional physical therapy. So I'm always excited to talk to people about it. But
I have a big question for you. This is something that I get, and a lot of things that we deal with. Is it safe? Now, I know it's kind of a rhetorical question, but I want to specifically ask, are the electrical currents safe in this type of device? I mean, we have in the media, you have concerns of 5G, risk and different forms of current radio frequencies. So
or it looks intimidating to a patient.
Exactly. And me, I'll just go ahead and admit, straight out, I'm still the learning user. I'm more of the patient here. Maybe even for myself, I'm not as technologically savvy at these types of things. So when people ask me, I'm like, yeah, it's safe, but I'm not really sure why. And so I would like, is it safe and why?
What do we know about this type of current? Because this is a little bit unique. A lot of people think it looks like a TINS unit. Can you tell us maybe how that's different and how safe this is, or maybe who shouldn't use it?
Yeah, for sure. So great questions here. We absolutely want to make sure that safety first. I mean, we want to make sure that everyone who's using the Neubie is able to experience these benefits. But first and foremost, we want to make sure no one's getting hurt or harmed. I mean, that's vitally important. One other thing I want to mention, Ryan, when you were talking about your experience with your ribs and still having issues, many months after they had healed, that's interesting. I guess we'll just stick a pin in that and come back to that later. But it's so interesting because a lot of what we're dealing with is not necessarily the injury, but the response to trauma.
Right.
And how it's so interesting how even months after the injury is healed, you can still have that same response that can keep you locked in that cycle of dysfunction or chronic pain. And I think that's really instructive because it allows us to see in that it's even more clear the distinction between the injury or the trauma and the response to that trauma. And early, when we work with people who have recently been injured, we try to make that distinction, but it's even more obvious when you expand them out into different time horizons like that. So
great point.
I
love that.
Thank you for circling back on that.
I can re-ask this question too, but one of the most amazing things, my first experience in the NeuFit clinic, I came in for essentially shoulder rib pain, and what you guys found that just really blew my mind was that I had tendons in my lower leg that weren't supporting, muscles that weren't working. Wow. And I would love to, we'll talk about this too when we're on the show, but it's amazing to kind of think about how your body's just working together, this global approach, all these muscles working together.
I'm saying our body knows what it's doing. It just needs a little support.
Needs a little help.
Yeah, it needs a little help.
Yeah.
So
and safety. I don't want to ignore that question.
Yeah, let's talk a little bit about who shouldn't use it. Are there contraindications? And for people that walk in and they're feeling a little bit timid, how is this safe? What do we know about this type of current?
Yeah, excellent questions. And first thing we want to say is it is FDA cleared. And so there's numerous safety checks and quality assurances and more paperwork and testing than if you haven't been through the process than you can probably ever imagine. And so there's a very rigorous process to even get this, get that clearance to release a medical device in the first place and all of that. So in terms of the levels of current and the safety features and all that. So there's a very high bar of safety just to be able to enter this game, so to speak, or enter this market. And
so you've been blessed by the regulators, essentially. But I would really love to know from your perspective, talking to a layman like myself, how would you say that the electrical currents are safe, or at least are not dangerous or harmful? And I know that there are certain people that this may or may not be good for, but I just mean generally speaking.
Yeah. So then a few beyond the regulatory component to it, there's an interesting. So if we think about traditional light bulbs, incandescent light bulbs, you can go buy like a 30 watt, 40 watt, 50 watt light bulb, and if you turn the Neubie up to 100% output, it's going to be about 2 watts. And it's crazy to think about that because you turn it on, if you turn it up to that level, it can feel really intense. But I think it's also helpful to understand that in the grand scheme of things, it's actually even less than a light bulb. So these are very subtle, refined amounts of current that are engineered to match exactly the levels of current and the speed at which the signals are transmitted and many of the dynamics about how we send signals naturally in our own bodies. The signal is geared to and engineered to match that as closely as possible. So what we're doing when we scan this pad around or when we have the electrodes on the body and turn it up and send that signal, we're applying an electric field that these pulses of electric field that trigger impulses within the body to fire just the same as when our own sensory receptors are activated. If our touch receptors or if our load receptors, that the Golgi tendon organs are receptors that measure force in muscles or that measure length in muscles or position of joints, we're stimulating all of those, and the muscles themselves, depending on the settings that we're using, stimulating those. So we're sending that initial impulse, and that is being done to trigger the body's own mechanisms that are happening, the way we send those signals naturally. So really what we're trying to do is just kind of program in, almost like software programming, program in getting these exact pathways, and we're just sending that first, like hitting the first domino, and then it's the body's own mechanisms that are doing it. So that's what we're really trying to do, and that's part of what makes this so unique, is that we're able to match as closely as possible what the body's doing already, and really just amplify the existing channels and pathways to get the most out of the body's existing hardware.
You're empowering the body, and I love that, and you're working alongside of it, and so it's not something that it needs to overcome, which is most likely why, side effects and other things coming out of this that may be, less desirable are not a thing, because you're actually working along our natural chemistry and biology. So that's awesome.
And then in terms of, one other issue is, like, you think about side effects and risk, right? Mm-hmm. A lot of people are coming in for sessions at various clinics and saying, well, I've been told I might need surgery. Should I try the Neubie first? And most of the time I would say yes, because there's, in many cases, there's a chance it could help. That we've seen it help people avoid surgery. And of course the risk, is virtually zero. It's so low. Whereas the side effects, the potential risks of something like surgery, are serious. You can get infected.
It's so invasive.
So yeah. And even the risks and side effects of steroid injections or chronic anti-inflammatory use, there's more negatives there, and using the Neubie is so much lower risk and less invasive, and if anything, has more health benefits instead of health negatives. Sure. And so in context of those, if we're looking at the overall safety and weighing different options, I think it has a very, very good risk reward profile.
So you had mentioned people come in and ask, should I try this before surgery? Does that mean that anybody can actually come in and use it? There's no doctor's prescription or recommendation needed? Who all can use the Neubie?
That's a great question. So this comes back to, we talked about how it is approved by the regulatory agencies here in the U.S. Of course, that's the FDA. Because it's the maximum output power allowed by law, and with great power comes great responsibility. So,
sure.
So there is a requirement wherein the device has to be either used by a medical professional or under the supervision or oversight of a medical professional. So, most of the practices that are using it are physical therapy, chiropractic clinics, athletic training rooms. And then there's some, if people are using it in more of a fitness or wellness capacity, if trainers are using it, they would have a doctor who's there providing that sort of medical oversight. So that is important. And then it's mostly used in practices, but there are people who get the devices individually, and they would have to have a doctor sign off on a prescription in order to get it. So there is, definitely requirements like that to make sure that, like you said, the right people are using it, the wrong people are not using it. And there are, you had mentioned, Ryan, contraindications. So someone, for instance, who has a pacemaker or who is pregnant, those are contraindications. They shouldn't be using it. So we got to make sure there's a screening process to make sure that
you're a good fit for it.
Exactly.
Yeah.
Oh, I like that. The good fit for NeuFit.
Sure.
Yeah.
You just made it. New slogan.
Yeah.
New T-shirt.
So, okay. So you had mentioned earlier also that, people will come in to determine, whether surgery is right for them. There's a fitness aspect to it, so it may be to enhance their fitness performance. What other types of elements have you seen individuals utilize this device for, outside of maybe just recovering from an injury or just enhancing their athletic abilities?
Well, there's a few different use cases. One is definitely the blend of that is, athletics, sports injuries, and helping people recover faster. And this plays into a little bit of what we're talking about with Ryan's ribs, about how there's this difference between the response to the injury and the injury itself. And so in traditional physical medicine, physical therapy, orthopedics, we're so enamored with the symptom, the tissue that's broken and damaged. And if we if we instead shift our focus, of course that's important. If there's something that's broken and needs to be healed, sometimes surgery is necessary. However, we also, by shifting our focus onto the function of everything around it, on the influences that either accelerate or slow down the body's natural healing processes, by shifting that focus, we often are able to help people recover a lot faster. So it does naturally lend itself to athletes who are eager to get back on the field or on the court ahead of schedule.
Yeah, you guys had somebody in here in the clinic one day that I think had come from surgery just a day or two. How fast can somebody start to use the Neubie after, if they do have to have surgery?
Yeah.
How fast can they come in and start that healing process?
So that's a good question. This is another use case here in terms of the breadth of applications. After surgery, surgery really is a controlled trauma, an intentional injury to the body. And the body responds to that just in the same way it does to the trauma of injury. It shuts down some muscles, which is why you get significant atrophy after surgery. It creates tension in others to try to restrict movement. And in many ways, those responses are part of what slows down the whole healing process. And so the quicker after surgery that we can start working with somebody and address those issues, those responses to trauma, and try to reset them, the quicker we can do that, the more significantly we can influence the entire trajectory of that recovery. So we like to start working with people right away after surgery. Of course, there's some restrictions. Like if someone had knee surgery, if they had an ACL reconstruction and meniscus repair, and they're not supposed to be weight bearing for 4 weeks, say, just for example, not supposed to be weight bearing for 4 weeks, we would work with them and do as much as we can, but still honor that restriction where, okay, they're not supposed to be weight bearing, so we'll have them just lie down, bend and straighten their knee, do different leg lifts. But with the Neubie on, to help get these benefits, we'll just do as much as we can while working within those restrictions.
I think that always really is like light bulb moment for the patient when I say, yeah, you can go and try Neubie just a couple of days after surgery. And they really, I can start now. I can start getting better. And I think that's really exciting for them, especially if somebody's been in chronic pain for a long time and really been dealing with compounded injuries. I really love the idea that this can be used too with any kind of specialty. So if you have a clinician who specializes in maybe like one area like spinal mobility or post-surgical therapies, they can really enhance what they do and their approach using the Neubie. It just fits really seamlessly. I'd love for you to tell our listeners too, kind of what the NeuFit method looks like, because there are so many elements to this. Like the MAT testing really fascinates me. The nerve glides. I think these might be interesting.
And MAT defined, please, for me and the rest of the listeners.
I'll let Garrett take over.
All right, Garrett, it's on you.
He's the pro, and I'm still. I love this, but I think the listeners will be really excited to hear that there's so many things that come with this.
Yes. So we've been talking a lot about the Neubie device, Neubie for neurobioelectric, and that's kind of the centerpiece or the cornerstone of NeuFit. It's a big part of what we do. However, there's more to it than just the device. There's as Ryan, as you mentioned, there's a whole methodology. There's methods of testing and assessment and other treatments and movements and much of which we have the machine applied during, but there's things that we do even without the machine. And so it is an interesting distinction there, and everything that we're doing, we're again looking through that lens of the nervous system, optimizing neurological function, trying to optimize the body's response to injury and trauma so that it can heal and recover as effectively as possible, trying to optimize function during training, fitness, performance, wellness, all that. And when we're doing manual work, for example, we're working within that same paradigm, whether we're using the Neubie or not. So we're still applying those same principles. And to answer your question, Shannon, so MAT stands for muscle activation technique. What we do is different from that. We do, it's a blend of techniques that you might see if you're doing MAT. There was a guy on our team here who actually did MAT. So that's a specific discipline within this overall realm of manual muscle testing and manual therapy. So muscle testing is, imagine you were, for listeners here, imagine you were lying down on a table and you were holding your leg up in the air, and then your doctor or therapist or someone was testing you, and they would try to push down on your leg and you'd have to hold it up. So they're just looking to see, like, can you turn this muscle on with a reasonable amount of force, turn it on in a moderate, reasonable amount of time, and are you able to get the neurological signal there in the first place to turn that darn muscle on? Because if you can't even turn your muscle on just in that sort of very simple, low threat environment, then when you go and do more challenging things, you're not going to have much of a foundation upon which to really build anything meaningful and make that long-term meaningful progress. So one of the things that we do start with is manual muscle testing, and it's the same type of thing that we're looking at with the Neubie, is that if someone can't engage a muscle, we're going back to your point, Shannon, about the body knows what it's doing. So the body's often shutting down that muscle for a reason. It doesn't just want to be weak. It often weakens or inhibits or shuts down muscles as a protective mechanism. And that could mean that it's because a joint is a little bit out of balance or out of position, and the body doesn't want to move powerfully around a compromised joint because that could lead to injury.
Kind of like a pulley system that's just off kilter a little bit.
Exactly. Yeah, exactly.
Well, this just goes back to, he's identifying the root cause instead of the symptom, which is the muscle's weak. That's a symptom.
Yes.
But why? And I love that you asked that.
And I think all of these different components, the kind of key takeaway is that we're identifying to make this process more efficient for the patient. And I think that's so fascinating. And I learned so much just kind of coming into this, thinking it was going to be about a device, but really there's just so many layers to this. When I describe this to patients, I always say there's kind of like four main things, but I'd love for you to add on to this. I always talk about the scan. I talk about therapeutic applications, fitness applications, and then also the master reset, which sounds so exciting.
Ooh.
People always want to know, what's the master reset? And I'd love to have you talk a little bit about the brain and the brain's relationship to movement.
Yes.
Oh, yes. This is a good topic here.
Everybody get a snack and come on, have a seat. This is a good one.
So the master reset is a protocol that we use to help increase parasympathetic nervous system activation. And so it's part of the autonomic nervous system. So for people listening, I'm sure you've at least heard, if you don't know what those words mean, don't be intimidated. You've probably at least heard of the fight or flight response, the stress response, how we spend too much time in the fight or flight response. And the opposite side of that within the nervous system is the parasympathetic or rest and digest response, rest and digest side of the nervous system.
The side that many of us need to spend more time on.
Yes, that's right. And when we hear about the negative effects of stress and the elevated rates of lifestyle diseases, whether that's people who need blood pressure medication or have constipation and need to take laxatives, or have infertility issues, or the organs, the intestines and digestion and elimination and the reproductive organs, those are all fueled, they're innervated by the parasympathetic nervous system. So when we're in a stressed out fight or flight state, the opposite side of the nervous system, that sympathetic side, is taking energy and resources away from the visceral organs and sending it out to the body so we can fuel the muscles to meet a challenge. And that's good for a period of time. But if we're in that state for too long, of course, that has consequences, because we eventually need to send resources back to our digestive tract. We need to eat food, break it down, absorb those nutrients, and repair and refuel us for the next challenge. And if we never pause between challenges, then that's where a lot of these issues come from.
Our body thinks we're running from a wildebeest at all times.
That's right.
Oh, I like that. I usually hear tiger, but way to switch it up. I just had a visual right now.
I think, and that's something that a lot of people don't think about, especially when their goals are things like weight loss or reducing cortisol levels. They're, going out and exercising to extreme and really trying to sweat, get their heart rate up, and really not thinking about how important it is to let the nervous system rest, especially for very simple things like digestion. So I think that's an amazing point. I kind of touched on the fact that when I was going out searching for a device for a very specific client, that's kind of how I found Neubie. But what I didn't mention is that she was 30 years out from a stroke and was really looking for something to help assist basic day-to-day movements and help her utilize not only a stronger nervous system, reduce compensation patterns, but this has been really amazing for me to watch patients coming out of stroke, MS, Parkinson's, any kind of nervous system disorder. And I'm just really fascinated by how this device and the method can assist somebody dealing with those things that maybe is feeling frustrated and lost and unsure of just where to start.
Yeah, that's a huge use case there. Just to finish the thought on the master reset.
Oh,
so
please.
the master reset, it helps us switch into that parasympathetic. Basically, stimulates the vagus nerve, the autonomic nervous system, helps us make that shift so we spend more time in that state. And then, yes, let's talk about, sorry, I just want to make sure.
No, I love that.
I love how you're able to like file
Stay
and
on.
store information. It's like, and by the way, this is what we were talking about. Thank you for that. Thank you.
Yes.
Well, and the master reset too. One thing I should say is what it looks like, because people often think that my patient's taking a nap because it's very passive, and it's 4 pads and it's occipital ridge and soles of the feet.
Yep. So basically, you're thinking like brainstem, base of the skull, and the back there, the neck muscles, which are very highly innervated. You got a lot of neurologically rich targets there, and you just, lie down and focus on diaphragmatic breathing. Sometimes people, do take a nap, and if so, that's great. But
That's great.
That's my kind of treatment, right?
Yeah. Yeah, I've seen this combined with some really amazing add-ons. Like people are using like solfeggio frequency music and little eye masks, and really taking some time. I think of it sort of as like assisted meditation.
Yeah.
Where it just kind of helps you get to that nice calm state a little bit easier.
That's an awesome way to put it, because we've measured, heart rate variability before and after, and we've seen it jump from 40 milliseconds to 140 milliseconds, for example, or
That's
something like
amazing.
that. And so, is there value in intentional breathing and meditation? Absolutely. And I used to say it's, enhancing or amplifying that experience, I think, is a great way to put it. You're just helping whatever shift someone's able to make, you're just helping them kind of push them a little further, or increase their momentum in making that shift.
And I think it's really encouraging too for patients who are having trouble deciding how to move without pain, and knowing that this is something they can do to benefit their health and their nervous system without any kind of adverse reaction.
Yeah.
So as the founder of NeuFit, I would love to know the inspiration behind this. So I'll just turn it back over to you. That's all I had to say.
Yeah, great question. So really, it comes from an experience that I had. I played college ice hockey up in New England.
I'll say you're not from Texas then.
That's right. Yeah, I grew up in Chicago.
I think they do have that around here somewhere.
There's some hockey down here, but not as much as in Chicago where I grew up. It was a big thing. So I loved the game, and I actually got passionate about physiology in the human body at first, because I was trying to turn myself into a better athlete, and I ended up getting something far greater than that in the form of this injury that I had in college. And I had some torn ligaments in my wrist. I was supposed to be out for 3 months and have surgery. And through a serendipitous introduction, I met a chiropractic neurologist. So if anyone listening is familiar with this kind of niche field, the Carrick Institute teaches and trains professionals in functional neurology. And I happened to work with one of the first, people who were certified within this subspecialty, and I went to see him, and it was a breath of fresh air, because in my previous injury experiences, everyone was so enamored with, we need to have this anti-inflammatory, this brace, you might need this surgery, and it was all focused on the tissues. And he was the first to expose me to this other way of thinking, getting to the root cause, asking why. If our goal is to get to healed, what could possibly be standing in our way? Why might you not, be able to get there on your own? And part of the answer is because of how the body responds to trauma. I know I've mentioned that. One of my favorite sayings is not what happens to us as much as it is how we respond to it. And I think that's true in so many areas of life, including physical injuries. And the work that we did, first of all, was to test and identify where there was weakness or muscle dysfunction around that site of injury, where my body wasn't supporting that injured tissue to kind of lay that foundation for it to heal. And we worked on those, and then he introduced me to a more primitive form of direct current. It's more of a microcurrent, and we used that direct current to help my ligaments heal. So we did.
So you were the first test subject.
That's right.
First guinea pig.
So I there is a rich history of direct current. I do think that what we're doing now is truly taking it, to the next level, kind of the next generation. But we are standing on the shoulders of giants and working off of a rich history. And so direct current, historically, people knew these benefits about how direct current could help accelerate the cells in the body that control healing and regeneration of tissues. And I saw that firsthand going through this process, where I was able to heal my ligaments in 2.5 weeks instead of 3 months. I avoided surgery altogether.
Yeah.
And in that experience, one, I was just so impressed and blown away and humbled at the healing power of the body, and like almost, felt this kind of, aha, eureka moment. Like I knew that, I didn't know the words for it, but I knew that was there. I knew we could do it. And then also in that moment, I had this calling. I felt this calling to share this work with as many people as possible. So I ended up, hit the microphone there. I got excited. I was talking with my hands. So ended up, I came down here to the University of Texas in Austin for graduate school in engineering. And as I was finishing up in engineering, I made arrangements to work with a local doctor here and start doing these types of treatments that I had experienced. And over the years, I just saw so many ways I wanted to improve the technology, get it to do more things. Like I said, there's a rich history. There was a lot out there, but I just wanted it to be able to do more. So I was able to find some other engineers who had very specialized knowledge in electrical engineering, and come up with prototypes. And we were blessed to have a couple of patents, and over a few years we're able to get the device out. And now we've had it out for by the time we're sitting here today recording this, about 3.5 years. And it's cool to see it's come a long way. But really, it comes back to that experience I had that kind of changed the trajectory of what I was doing with my life. I thought I was going to be an engineer, and
you are.
In a way, yeah.
Kind of am. But
And going back to the bio, I think you're a health engineer. Is that the right title for you?
That's right.
All right,
yeah.
I like it.
I have a good friend who's actually a functional medicine doctor, who gave me that nickname, and I kind of liked it. So it stuck.
Put it on your name tag.
That's right.
I think this is so amazing, and people will see this in the show notes. But can you just tell? You kind of touched on this just a minute ago, but when we're talking about Neubie, we're spelling that Neubie, and that's sort of an acronym. Can you tell us again kind of how you came up with the name and what that represents?
Yeah, so Neubie is neurobioelectric stimulator, nervous system biology and electricity. And then NeuFit is neurological fitness. We're trying to help prioritize the nervous system, work on neurological fitness, because we find that it is the nervous system that controls all these elements of healing and health. And by working at that level, we're able to help people with all these outcomes. So we tried to put front and center what it is that we're doing. And now we just got to try to get the word out and get the message to more and more people.
Love that. I do want to ask you one more question that I'm really curious about. And mostly this is just because my client base is really going to force me to ask this. They always want
I can see your arms twisted right now.
I know. Yeah. I'm so excited. Well, I did ask a few questions beforehand online and wanted to hear from patients that have tried this and be able to pass on questions for you. For anybody that has maybe recently been diagnosed with something like MS or Parkinson's, how do they start? I mean, should they just reach out to somebody at the NeuFit clinic, or what do you usually advise for them to come in and find out if this is a good next step?
That's a great question. So first thing I would do is, I think it's important to just share with people a little bit about where NeuFit may fit into their
treatment
recovery
plan.
journey.
Sure.
So like with MS patients, for example, we want to tell them that we're not treating the underlying autoimmune condition. And so it is important. A lot of people, if they haven't heard already of Dr. Terry Walls, we often would recommend, first thing, please buy the Walls Protocol, Dr. Terry Walls' book.
She's amazing.
Wonderful, very inspirational woman. She stopped her own MS progression, transformed herself, and is now teaching tens or hundreds of thousands of others to do the same. She has research on lifestyle interventions that show just as good or better outcomes at stopping the progression of MS, just as good as immune suppressing drugs without the side effects. The only side effect is, you get healthier and you, other things improve too by following, these healthy lifestyle practices.
That's true. Side effects can be a good thing, right? So it's a good side effect.
And
I like
she's
it.
a huge fan of NeuFit, talks about it all the time, and really, really preaches this method.
Yeah. So there's a couple things, a couple parts to the recipe for success here, if there is one. And the first is to work with her method or something like that to try to stop the progression of the disease. If there's this autoimmune fire blazing inside, we need to put out the fire first before we try to rebuild the house, so to speak.
Right. That's a great way to say that.
And so what we're trying to do is then, get that piece in place first, and then where we come in and what we're trying to do is work with people to help restore any of the function that's been lost. So people with MS who had to give up driving or had to get a caregiver at home or are wheelchair bound or just lost a little bit of sensation or a little bit weaker or lost a little bit of coordination. We're able to work with them using the Neubie and the NeuFit method for another buzzword, neuromuscular re-education, right? Trying to re-educate, rebuild the nervous system's ability to fire the muscles. MS is a disease specifically that targets the nerves, and so we're trying to help them rebuild and restore function. So what we're trying to do is really tap into the power of neuroplasticity, the body's ability to heal and adapt within the nervous system to help people recover that function. And sometimes they get a little bit better, sometimes they get out of wheelchairs and regain their lives back. There's some profound.
I love that.
There's some, we've seen some profound transformations. But I'd recommend if anyone was interested in to actually answer your question, what I would say is, check out our website is neu.fit/locations, and they can find somebody near them if they're here in Central Texas. Of course, we'd love
Lots
to
of options.
welcome people into our home office here in Austin. It's kind of our laboratory and our showroom and teaching center. So we have therapists here that see patients as well. But we have a whole network of wonderful providers around. Now I'll say around the world because we just
That was my next question is, are you
right?
just located in Texas? Are you in other states? Or can you give us a geographic idea of where the locations are?
Yeah, so we've there's a couple hundred around the United States in terms of, physical therapy, chiropractic clinics, some gyms or other facilities like that, functional medicine practices that have them. When I say have them, offer NeuFit, have the Neubie device, and then we just started in the last year we got the clearances to be able to sell in different countries. So there's
Awesome.
some providers in Canada, some in Australia. We should have a couple coming.
So around the
in
world.
Europe. Yeah,
Yeah,
we can say it now. We can say around the world.
I know we're going to get some emails from practitioners who are interested in other countries, so it would be great to be able to connect them and have them chat a little bit more if they're interested
That's
in
right.
getting
You
a
could be
Neubie.
the first in your country.
I like that. I like it. Today we've learned that when dealing with pain, injury, or trauma, there's a way that we can directly address the cause of such discomfort rather than just focusing on the symptoms. In doing so, we can potentially avoid evasive surgery and avoid or reduce the need for medications. Now, this has truly been an incredible insight into not only a therapeutic device, but also a healing methodology. We are extremely grateful to have had the chance to speak with the founder and CEO of NeuFit today, Garrett Salpeter.
Thank you so much. It's been a pleasure being here with both of you, and excited to share this with your audience.
Thank you so much for being here.